Great.
Yeah.
Welcome to Expert 35 Live. Again, my name is Gabriel. We got 35 different experts from 35 different industries, experts from each, and talking about the challenges, talking about the hardship and the opportunities. And today we're going to talk about opening back up from a doctor's perspective, like what, especially on some of the non-elective stuff. And we got Dr. Malik. Thank you for joining us today. How are you today?
Thank you so much. I'm doing well.
A lot of people are worried about like getting back into it, like what are the next phases, and obviously you have a great story. So before we get into it, just tell us a little bit about it. So it's you and your sister, and you run an optometrist facility here in Houston, right?
Yes, my sister and I opened up Pro Optics in 2015. There's three of us. There's three sisters. We're all optometrists, but two of us are in business together. One, we're trying to get her to move to Houston, but until then, it's just the two of us.
And you came to Houston. You're a Cougar. You went to U of H.
I did. I went to optometry school, U of H.
All right. Well, we'll give you a shout out to you, the Cougs. I went to Rice, so we're an Owls. So we got a little bit of a group all over. Some of the experts have come from all over the country, but it's kind of nice to have some local Houston representatives.
Thank you.
So, but yeah. So anyway, so you went to school. You guys are a couple years apart. You convinced her to come down, and now let's. Before you get into this, I gotta show this. Let's show the sisters. Here's a photo. I'll get myself out of here because nobody wants to see me.
Yeah, that's the two of us. So she's 6 years younger.
Perfect. All right, now we got a bunch of questions. Oh my God, we got to go Owls. We got a couple of people on the stream. I'm glad we now know we're live. Well, tell us, you're in this industry, you're opening up again. What are some of the client's biggest concerns as you're opening up again?
So the client's biggest concerns are, is it safe to come in for a routine eye exam? During the pandemic, of course, we were closed, but only open for emergencies. So the calls that were coming in for routine, we were not able to see them. And so, generally everyone's concern is it safe to do routine eye care at this time? And if they do come in, is it safe to go to these facilities? What kind of precautions are the facilities taking to keep their patients safe?
We already got great questions coming in. Obviously, people are worried, right? Is it still safe to wear contacts? That's a direct question at you.
That is a very good question. I mean, one of the studies that came out during the pandemic was conjunctivitis as being one of the signs of having, the virus. Contacts is tricky, but we do think that it is safe to wear your contacts, but we have to make sure that we're cleaning them appropriately. We almost 100% recommend daily contact lenses where you're throwing them away every day and fresh pair goes in. That's the safest way to wear contact lenses, especially at this time. So we avoid the whole storing in the case, and because sometimes they're not being cleaned appropriately when they're being put back in the eye. So we risk some exposure there. So dailies is the way to go.
Here's another great question. People are, they're not supposed to touch their eye. How can they stop touching their eye?
Yeah, that's a tough one because everyone knows about the nose and the mouth, and the mask does a good job from preventing that. Those of us who wear glasses, that's a great way to have a protective barrier for the eyes. Any kind of protective eyewear is great. Even if you don't have a prescription, having a pair of protective glasses with no prescription, maybe just blue light to protect from the screens, that can help as well, as far as not touching your eyes. But yes, that's definitely one of the concerns, is that we all worry about mouth and nose, but the eyes are exposed. So
right. Oh, there's Jennifer. That's the question. Should we wear eye protection and a mask?
Yeah, absolutely. 100%. I mean, when I'm seeing patients, I don't have a prescription. I wear protective glasses with my mask. Absolutely, 100%.
Well, now tell us a little bit of, obviously people are worried about getting back into it. How do we address the fear of visiting elective medical facilities? Like, what are things that you think would be proper steps?
Just making sure that the facility that you are going to is taking, those extra precautions. asking screening questions, making sure that they're not allowing patients in that have had, previous symptoms or exposure. There's, a list of screening questions that we do ask. And so I think people should look for that. Of course, safety measures as far as staff and patients wearing masks, maybe limiting the amount of people that are in the waiting room, looking for those things, maybe avoiding high traffic offices, and finding offices that are scheduling, enough time apart where there's no sharing of waiting rooms or tight spaces. So that sort of thing. I think that's what people should look for.
Now, is this something, can we just ask? Do you just ask the doctors like, hey, how many people are in the waiting? I mean, how do we know, other than if we got this nice fancy email, like if you don't have an email and you don't know the doctor, can somebody just call you and be like, hey, what are you doing?
Well, I think that just kind of finding an office that's maybe not in a high traffic zone. Like there are offices that are attached to like department stores or like a Walmart's and Targets and things like that, those tend to be a little bit more, high traffic areas, maybe offices that are more private owned and, maybe office buildings that are not as high traffic areas, maybe that could be. And then I don't think it's a bad idea to even just call and say, hey, I'm concerned. I wanted to come in for my routine. What are some of the steps that you guys are taking in order to keep, the patients safe, and just kind of screening that way and making a decision of whether you feel comfortable going to that facility or not.
Right. And there are resources, like you said, the CDC is telling people like, hey, clean after every section and make sure you don't have as many people in the waiting room. So you can kind of read these and match them up with whatever facility we're talking about, right?
For sure, yeah. And not everybody is following the same guidelines. But generally speaking, I think just spacing out patients, avoiding overlapping, and making sure that everything is being disinfected between patients is really important.
I mean, totally. Here's an interesting question. My eyes hurt from being on Zoom all day. This is the problem.
Yeah. So, I mean, that's a great question. When we opened May 1st, believe it or not, we had a lot of people with the same complaints that their screen time has increased because of all the work they've been doing on Zoom, etc. So, I mean, yes, eye fatigue is a big problem. Blue light exposure from the screens, is increasingly becoming an issue. So a lot of things, that we could do to address that. They could definitely, when they go for their eye care screening or appointment, that's something that needs to be addressed. There's a lot of different things that can be done, from getting blue light lenses.
Some of the new monitors even have like adjustments for blue light and stuff, which is great.
They do. They do. And same with the phone. They don't block all the blue light that's coming through, but you can do that. Definitely helps. They have a setting. I don't know, but the iPhone definitely has a setting to block out the blue light. But yes, there's blue light glasses, lenses that are available, anti-fatigue lenses, like things like that, computer glasses, lots of different options.
I'm a scuba diver, and so I'm totally interested. How can I keep my glasses from fogging up when wearing a mask?
Yeah, that's a big problem. So what we've been doing is underneath the mask, if you put a tissue underneath the mask, what happens is the moisture gets absorbed by the tissue and it doesn't get onto the glasses. So, but it has to be tightly secure on the nose area. So that's what we've been doing. We also have anti-fog treatment for the lenses as well. So, wherever you get your glasses from, ask about the anti-fog treatment for glasses. If glasses is the only thing, and you don't wear contacts, that's a good option. Or the Kleenex technique works pretty well. So we've been doing that here.
Great little technique. Here's a great question from Jennifer also saying, how many patients are allowed in at once? And I guess you have a couple of rules, right? Based on the waiting room, but also into the actual,
Yeah, so we have reduced our schedule to one patient per hour. So we're able to do the whole exam in the whole hour. So we don't have any patients sharing the exam or sharing the office space, especially the waiting room or the optical where people are trying on glasses. So there's no overlap there. So once the patient is done, the whole office is sanitized and wiped down, and then the next patient is able to come in. So basically they're waiting in their cars until we're ready for them. So our system sends them a text message indicating that
keeping the social distance and keeping them safe, and it gives you time to clean everything up because you are touching. I mean, you're in that space, right? What about pediatric patients?
Yeah, we do see kids. We see age 3 and up. My sister is the pediatric optometrist, so she does the kids' exams. We do ask that we always ask here that we want one parent to come with the kids.
Great. And this is a really good follow-up question, obviously. What precautions should patients take before coming in for an appointment if they're a family?
The precautions basically would be, we ask that everybody wears a mask at their appointment. If they do not have one, we have masks available here for them. Mm-hmm. Just common sense social distancing measures. Also, there's forms that we send out before their appointments that need to be filled out. So we screen them before, and the questions just ask about symptoms, about if they've traveled, any kind of high risk, immunocompromised conditions, things like that, in order to kind of red flag anyone who we need to either reschedule or take extra precautions.
Right. Great answers. And of course, I mean, just so timely because people are going through this right now. Doctor, 3 things we need to do now. This is like my favorite part of the show.
3 things you need to do now. If you have an eye appointment scheduled, you need to fill out a screening form indicating that you are safe, healthy, symptom-free, and able to do your routine eye exam. The second thing would be if you do have any of those symptoms that are indicated on the screening form, do not show up for your appointment. It is best to reschedule to keep yourself and others safe. And the third thing would be find a facility that you feel comfortable with and who are implementing social distancing measures and protocols that make you feel safe and make the staff feel safe.
Great points. Again, Expert37, Dr. Malik. If you text Expert47, you're going to be able to get contact with her, be able to understand a little bit more about their facility. They're here in Houston. And of course, you're only letting one person every 15 minutes, or wait, a 15-minute appointment, 1 an hour, right?
Yeah. Yes.
So there's time to clean. I mean, the people are staying outside. You're cleaning between the frames. I mean, it's just, so important to see, experts in your industry leading, the way you are. Thank you for being on the show. Thank you for helping us out today.
Thank you so much. I appreciate it.
One last thing that I know we didn't touch about is like you have to be board certified, and there's a way that you can like see their credentials. They're on the board, right? They have to be displayed.
Yeah.
This is looking for a location. Today I went to rent a car and I was like, oh my God, it's the same thing. So I didn't go to like a common location. I went outside of town and it was great. Population 2 people, got a car. It's kind of the same thing. You kind of have to think about that same common sense. Is you don't want to go to a strip mall right now and try to get your eyes checked. You want to go to like a small, a great, very reputable professional. And in your case, I'm going to put the sisters back up. It's like the sisters both work there. They're both doctors, right? Yeah. So thank you so much for being on the show. It's great information. It's great having you.
Thank you. Thank you so much.
No problem. All right, guys, you've heard it. Text Expert35. You want to follow us. If you want to catch up, we're going to let her answer a lot of the questions on there. I see a lot of Go U of H, Go Owls. So she's going to have to go talk to some of those people and put them in place as well. But there's a lot of questions that being answered, a lot of ways to stay safe. And we really, really appreciate everything she did. We're going to leave a pretty cool screenshot of her in action. And we have Jana coming up tomorrow. She's going to be talking about liability. She's going to be talking about the corporate liability, really important in terms of businesses and staying informed. So join us on Expert35. Thank you, guys. We'll see you guys soon.
We educate during difficult times. We collaborate at Expert35. This is for a better tomorrow and a better today. Let's come together and together we will find a way. You got questions, we got solutions. You got problems, we got resolutions.